Well, emergency doctors have drafted health targets of their own and they want Minister Andrew Little to adopt them.
It comes as several deaths and close calls associated with emergency departments dial up pressure on the government. Nick Truebridge reports.
Sick of the state of our country's hospitals, our emergency doctors have taken to penning policy.
If you don't have a target in place, then there is no main aim. There is nothing that you're training your system towards to become a healthier system.
They're called hospital access targets for admissions. Greater than or equal to 60% of patients should have a stay of no longer than 4 hours, 80% no longer than 6 hours, 90% 8 hours, 100% should be through ED within 12 hours.
We would love for these targets to be met the majority of the time, because we know that those targets would allow our patients to have a better experience and be more safe.
The Labour government scrapped National's so-called arbitrary health targets back in 2017. It did introduce indicators, but ED wait times have still ballooned. The Health Minister today rubbishing suggestions the government's opposed to health targets.
We have measures in place for EDs who are required to achieve at a level of 95% either treating, discharging or admitting patients who go through ED within 6 hours.
But in a puzzling twist, Little's press secretary emailed Newshub Research showing targets don't work. National says, whatever the measure, there are a few signs of accountability.
It is reported, but they are not held accountable for it. That's how it looks.
Meanwhile, in the middle of the target tangle, ED doctors slog away on the front lines.
What we really want is just to be enabled to do our job well and to come away from our day knowing that we really did do good that day.
Our doctors and nurses battling away during trying times.
Well, kia ora, Nick. There's even more pressure piling on the system tomorrow.
Yeah, there sure is, Ingrid. As of tomorrow, 4,200 primary care nurses will walk off the job. That includes people employed by places like your local A&E department, your local medical centre and Plunket, which is what I'm standing just outside. Now, why are they walking off? Well, it's basically over their employers' inability to secure pay parity with their counterparts at Te Whātau Ora. Now, we've heard from Plunket this afternoon. It says this is the first time in 35 years that its nurses have decided to walk off the job. So what does it all mean? Well, it's, as you say, more pressure on a health system that you would have to say is looking increasingly unhealthy. Ingrid.
Yes, thanks for the update, Nick.